Welcome to the ICEM2012 podcast. Today we talk to Dr. Fergal Hickey, consultant in emergency medicine at Sligo General Hospital and chair of the ICEM2012 local organising committee.
Dr. Hickey, can you give us a quick background to what the ICEM meeting is all about?
This is the 14th ICEM. The first took place back in the 1980s. At that stage, it was a meeting that rotated between the four founding members of the International Federation for Emergency Medicine, namely the UK, the United States, Canada and Australasia. In 2010, Singapore was the first of the non-founding members of ICEM to host this meeting, and Ireland is the second non-founding host. So this is the World Meeting for Emergency Medicine, and as I said, takes place every 2 years, but it's likely to be the first time it's going to be in Europe for 10 years and probably not going to be here for another 10 years.
And was there a particular reason you wanted to bring it to Ireland?
Well, emergency medicine in Ireland has been established for a long time, and we felt it was important, A, to showcase Ireland, and B, to showcase Irish emergency medicine and give people the opportunity to come to a country which is well worth seeing, is a very sociable and hospitable place to come, but also has contributed significantly to international medicine.
And are you looking to use ICEM2012 as a way of demonstrating Ireland's current capabilities in emergency medicine, or are you looking for us to benefit from the international experience that the conference will bring to these shores?
It's a mutual benefit. Essentially, emergency medicine is different in different parts of the world. It's very advanced in some countries. It's clearly very primitive in third world countries, although the standard is narrowing. We would see ourselves in Ireland as having a standard of emergency medicine reasonably similar to that exists in our near neighbour, the UK. But there's an opportunity for all of us to learn from one another, so we can learn from best practice elsewhere, and likewise many of those who come to this meeting will be able to learn from practices in Ireland. And many of the speakers across a number of topics are actually Irish speakers.
And the scientific theme of the meeting is bridging the gap between evidence and practice. What does that mean in real terms?
Well, I think it's important that what we do is evidence-based. So rather than we do something in a particular way because we've always done it that way, it's important that there is an evidence base for it and we can justify what we do. And therefore it's important that science is used to guide treatments and interventions. And we would hope that there would be a number of cutting-edge presentations which would describe the information is, what the evidence is, and therefore the standard of care that should be provided. And that will be beneficial to people from all countries. There is no one country in the world whose emergency medicine is better than everybody else's. Everybody has something to learn.
There are a number of world-leading speakers at ICEM 2012. Are there any in particular you personally are looking forward to?
Well, in general, the plenary speakers have been chosen because of their outstanding contribution in a particular area, and each ICEM meeting has a limited number of plenary speakers, and these are people who we can all learn from, whether it be about how decisions are made in emergency medicine, Pat Croskery's talk, or some of the resuscitation material that's been given by others. All will be worth people seeing.
Of all the specific tracks within the scientific programme, which do you see personally growing the most in importance within the next 5 to 10 years?
Well, because emergency medicine covers such a wide area of medicine, I think you'll find that different people will be coming to listen to particular areas that interest them or that they want to develop on. There's obviously an important issue of technology and the contribution that technology can make to emergency medicine. Emergency medicine is one of the most data-intensive branches of medicine. It's also one that we have streamlined a lot of processes, and anything that can contribute to those processes taking place more efficiently is clearly beneficial. So, things like point-of-care testing, access to rapid, immediate diagnostics, those kind of things make a huge difference to how emergency medicine is practiced and will be practiced.
When you talked about how it's practiced, there are a lot of practical pre-conference workshops going on. Can you just give me an overall sense of what they are about?
Well, there's a mixture of pre-conference workshops. There are those which use time-honoured, well-established courses, be they the Advanced Paediatric Life Support course or the Medicals course. So they're an opportunity for people who perhaps don't have an opportunity to attend one of these courses in their own country to come to this course, but there'll also be cutting-edge presentations, so advanced ECG interpretation, for example, paediatric sedation, practical nuts and bolts, hand-on experience for people, and also the ultrasound workshop, which will give people an opportunity to actually use the equipment and learn the technique of ultrasound. So again, we expect that there'll be something for everybody.
And the major part of any ICEM conference is the social programme, and this year looks pretty spectacular. Can you give us a sense of what the delegates can expect?
Well, I think, again, Ireland is a country that's known for its hospitality, and we would certainly expect that our social programme would match the best.
Well, fitting in nicely with the theme of emergency medicine, we've had to move out of the way and into another part of the hospital to let people do more important work. So back to where we were. What exactly is the entertainment package that the delegates will be getting?
So the entertainment package that we have in mind for people, and we're very much looking forward to, is going to combine Irish traditional music with more modern Irish music with international music, and we think people will genuinely enjoy that. Ireland has a reputation for hospitality, and we intend to ensure that our gala dinner is something that people will remember. So when they've gone back to their country, wherever in the world they've come from, whether they're Irish or have no connection with Ireland, we would expect that they will remember this and remember it positively and fondly.
Not to be controversial, but are you hoping to beat your predecessors in the entertainment stakes?
Well, we're hoping to beat all our predecessors in every respect. We would expect that our academic programme will be as good as can be brought together. We would expect to get greater numbers than previous ICEM meetings have got, and we would expect that the social programme will be something which will be memorable and people will remember fondly.
So is there any specific scientific tracks you think the delegates should look out for? Obviously they're coming from different areas, but is there anything that you would particularly look out for?
Well, I think what's going to be different about this particular meeting is that rather than the traditional way that these meetings have been run, the tracks are, for example, surgical, medical, paediatric or trauma, that the tracks are going to be arranged more like an emergency department is arranged. So there will be pre-hospital tracks, there will be resuscitation tracks, there will be major case type tracks, there will be minor case type tracks, there will be back office functions, and there will also be educational and international emergency medicine tracks. So people are going to get an opportunity to see it from the point of view of how an emergency patient goes through the patient care pathway.
How important is networking? Because you were saying earlier on it's an international conference. How important do you think it is for the Asians to come up with the Europeans and the North Americans, etc.?
It's very important. The type of patient, a heart attack is a heart attack is a heart attack. A sprained ankle is a sprained ankle is a sprained ankle all over the world. So we need to be coming together more, and we need to ensure that the standard of care provided, irrespective of where in the world this incident happens to, is the same. Now, we're not naive enough as not to appreciate that there aren't economic issues and that there is a variety of economic circumstances that befall different countries. But I think the other advantage of networking, apart from actually people working together and develop consensus around how things can be treated and treated better, is it gives people an opportunity to maybe go on exchange programs, or if you're a trainee, to make arrangements to go on a fellowship to another country, or if you have an interest, for example, in humanitarian emergency medicine, to an opportunity to go to a less developed country and have a potential to contribute there. So there are huge network opportunities, and people shouldn't undervalue the importance of networking. The academic program is going to be important for people, but it's the context that they will make in the fringes of this meeting, at the social events, at the coffee breaks, or whatever, that will often give them opportunities to further develop their careers or further develop their areas of interest.
Dr. Fergal Hickey, thank you very much.